All right. Well, thank you for coming to see me. Wherever I
No
caught you,
worries.
wherever I caught you in the week, how's it been going? What have you been up
A
to?
bit of a busy week, but not too bad overall.
Yeah, what kind of things have you had on? What's
Just work's been really busy this week, but apart from that, the usual.
no, so it sounds like work's kind of the main thing in your life at the moment.
Yeah.
You get a few hours out of that one, or
Yeah, that's an understatement. Yeah.
oh wow, really? So we're talking 9 to 5.
Yeah, pretty much.
Oh Jesus. All right. Well, I'm glad you've been able to find the time to come in and see me.
Yeah.
So what we're going to be doing today, I'm kind of run through just so you understand what we're going to be going through. First, I'm going to be having a little bit of discussion with you. What we're going to do, we're just going to have a little bit of talk, just kind of see where your head's at with exercise and where that is in your life. Obviously, you've been referred here by your GP, so we kind of need to see kind of what's underlying there. After that, what I'm getting you to do is we're going to have you fill out an SS screening form. That's just going to give me a little bit of background in terms of your health history and kind of if there's anything kind of red flags that come up that we need to be aware of, just so we can keep you safe and keep you healthy, because that's a priority here. And then after that, we'll get you into the gym and we'll get you running through a few exercise tests just to, kind of see where we're at so we can start, going for a program. How's that sound to you?
Sounds good.
Great. All right, Bruce. So yeah, on that, what can we help you with? What's brought you in here today?
Well, I went to my GP about a week and a half ago, maybe. So a couple of weeks ago, I was helping a friend move houses, and I pulled my back out a little bit a couple of weeks ago, and since then it's kind of just been like an underlying injury, and my GP reckons maybe just adding in some exercise to my kind of weekly routine would really help in fixing that, and also just for health reasons as well.
Yeah, okay, so it sounds like kind of this is maybe more of a precautionary thing.
Yes, definitely, and to help with injuries, I think.
Yeah, well, I mean, it's great that you're kind of being able to get on this early. It's, good to see that you're aware that there's an issue and it's not, some people tend to leave it a little bit too late and then by then you're dealing with, major stress issues and whatever. But it's good that you've come in now and we kind of want to get on top of that. So tell me a little bit about the injury itself. Kind of, is it, how would you say it's impacting your daily life and kind of, what is it, what kind of things is it limiting you to doing?
I wouldn't necessarily say it's like limiting me significantly, but it's kind of just like there throughout my daily life. Like when I'm sitting at a desk for hours and then I can really start to feel it getting a bit sore, or doing any form of lifting or like chores around the house, I can definitely feel it affecting me in that way. Just like underlying pain, it's just kind of uncomfortable and I want to, get rid of as soon as I can.
Yeah, you mentioned kind of at the start that you do a fair bit of work. Is there a lot of lifting involved in your work? Like, would you say it's impacting you a lot in the workplace? Or
I mainly just sit at a desk for work, but definitely when I'm sitting down for hours on end, it's definitely affecting my work in that aspect, I think.
Okay. Alright, well, I'll tell you what, you might have to bear with me a little bit. I know this is a little bit weird, but it's it's something that works just so I can kind of get in your head and see where you're at.
Mm-hmm.
So if you imagine I've got a ruler here, and then on one end of the ruler is a 1, and one end of the ruler is a 10. So what I want you to do with me real quick is if you can just picture that ruler and kind of use that if we start with your confidence in performing exercise. So if I can get you to rate on that ruler, so 1 is, I'm terrified of walking to a gym. I wouldn't know what to do in the first place. And then 10 is, just I want to be left alone, just let me off the chain, I just want to run loose and do everything. If you can picture that ruler, where would you say you sit?
Maybe around like a 3. Maybe I did like a little bit of tennis in high school, nothing serious, but I have like a little bit of knowledge about really basic exercise and training routines, but not very much that I would be in a gym and ready to go in that sense.
Okay. Alright, interesting. So bear with me. If we take that ruler again, and if this time can I get you to kind of rate your importance of exercise? So 1 would be, I can't be bothered whatsoever. 10 would be, I'm keen and I understand the health benefits. Can I get you to rate that one for me real quickly?
Maybe like a 5 or a 6. Like, especially with the injury, I've kind of realized how it affects me, and I really want to get it fixed in that sense. But it's kind of like it hasn't been, like the top priority in my life. leading up until now, but maybe I should give it some more,
Okay.
more importance.
Okay, so it's interesting. Can I just ask, if it's all right with you, why not say, because you were 3 on importance, maybe can I just ask why you're not perhaps a 3 in, no, you were, wrong way around, sorry, you were a 3 in confidence. Can I ask why you weren't a 3 in importance, like you bumped it up to a 6?
I think that just with like my very limited experience with sports, like I do understand like the importance of fitness and like keeping healthy and how it affects my life in that sense. So I think that's definitely why I'm higher ranking there.
Okay, so no, that's good to hear. It's nice, especially because we are talking about an injury. You know, we're not just talking about people who are maybe unfit. We're talking about an injury. It's good that you already have that foundation of, you know, this is important to keeping me. You know, it's important to keeping like my daily living and that quality of life. So, if I can just maybe draw a summary real quick, your back problem that's kind of influencing your daily life, but not quite yet. You understand why it's important that you get on top of that, but you maybe perhaps need a little bit of help in saying, you know, finding the confidence and maybe the motivation to, well, motivation's the wrong word, but maybe just a little bit of encouragement to get into the gym, maybe by yourself.
Definitely.
Okay. Interesting. So if we can just run down that. One technique that we like to use is to kind of maybe find someone who relates to a position that you've been in, that you are in, and then they've maybe, you know, they've persevered and they've put in the right effort, and then they've come out the other side and they've managed to, you know, improve themselves and improve that quality of life. So is there anyone, I don't know, maybe in your family or in your workplace that has had similar issues? It doesn't necessarily have to be back, but if it is a back issue, it helps. But is there anyone you can kind of...
I know that one of my family members not recently, maybe a couple of years ago, had like a spinal nerve injury. I'm not exactly sure, but it was much more significant than mine was.
Yeah.
But they went through like a lot of, you know, physio and like all sorts of doctors, and it took a while, but they got through it and they're able to go back to their like day-to-day lives now, which is good, especially because they've got like a really like kind of like a hands-on job that involves like a lot of moving and a lot of lifting in that sense. So it's that's the one that comes to mind for me.
It sounds like it would have been rough at your family.
Yeah.
That's good for them. So I guess, I don't know, because they're in family, so you would have kind of seen them go through that whole process.
Yeah.
What kind of, were you aware of what kind of techniques that maybe, what kind of exercises they were using, what kind of, you know, how often they were doing things to kind of help them get back on that road to recovery?
Well, I know that theirs was like a quite a significant injury, so I know that there was like constant like little exercises, like little things that had been prescribed to them. It was a lot of like with the doctor present, like, you know, very basic exercises, but just kind of getting the body used to, you know, how it used to run before all of this happened. But it wasn't any like extreme, you know, like workouts or anything in that sense. It was just kind of like persevering and persisting with the movements.
Yeah, so kind of maybe with you, I want to see if I can get your thoughts on this just based on that. Maybe you would feel better if we had someone, like if we could maybe do it as a one-on-one personal training. Personal training is the wrong word, but like one-on-one consultation, just have somewhere with you, you know, the whole way, just to make sure you're doing everything right and to make sure you're staying on top of it.
Yeah, definitely, because you know, I haven't been exactly keeping up on top of my fitness for the past couple of years, so I think I would be much like more comfortable if it was more of like a one-on-one type guidance.
Yeah, it's good to hear you use that word comfortable, especially, you know, if it's all right with you, I want to step back to that confidence, you know, now knowing that you'd have someone there with you, you know, just as like a reassurance and just to make sure everything's doing what it should be doing, and you'd have that there as kind of like that safety net. If I was to ask you to kind of rescale your confidence on that ruler, would you say you started at a 3, are you maybe now up to perhaps a 5 or a 6 like you were with importance?
Yeah, definitely. I think if it was more of like a one-on-one type situation, I'd feel like a lot more confident getting back into exercise and stability and things like that.
Yeah, no. Hey, that's great to hear.
Yeah.
All right, what we might do now, I'll go get that SS screening form, and then again, I'll just run with you through the test. We'll just keep it one-on-one like you said you preferred.
Yeah.
And yeah, we'll go get some exercise training done.
No worries.
Fantastic.